Understand the advantages and disadvantages of using an internal condom. Before you commit to using an internal condom, you should be aware of the advantages and disadvantages of using it instead of another form of birth control. Here are the pros and cons of using an internal condom. Advantages: the internal condom does not require a prescription and is therefore pretty easy to get. You can find it in most drugstores and some supermarkets. Internal condoms let people share the responsibility for preventing infection. Unlike the birth control pill, the internal condom doesn't have an effect on a person's natural hormones, though it may be used along with birth control pills for extra prevention, of course. It can stay in place, even if a partner loses their erection. It can enhance your sexual experience. The external ring can stimulate the clitoris during vaginal intercourse. It is made with polyurethane instead of latex, and can therefore be used by people with a latex allergy. It can be inserted up to a few hours before intercourse, and remember that you can use the bathroom while the condom is inserted. Disadvantages: the internal condom may irritate the vagina, vulva, penis, or anus if it's being used anally. It may slip into the vagina during intercourse. It can be a bit tough to insert it, especially at first. Wearing the internal condom can create a louder noise during sex, though this can be controlled with more lubricant. Understand how an internal condom works. The condom works like a male condom, but it's inserted into the vagina. It even looks somewhat like a large external condom, except it has a flexible inner ring that will be inserted into the vagina, and an outer ring that will hang about an inch from the vagina. Once the condom is inserted, the person can insert their penis into the condom. When they ejaculate into the condom, it should be removed. 3. The female condom can be effectively inserted into the vagina or the anus, and the method for insertion is very similar. 4. Remember that, if you are wearing a female condom, the male should not wear a condom. This will create friction that can cause one or both of the condoms to tear. Examine the package of a female condom. Before you use the female condom, check the expiration date on the package to make sure that you can still use it. Then, use your fingers to delicately smooth down the package to make sure that the lubricant is distributed evenly throughout the package. Practice using the female condom. Though female condoms typically cost around $4 per condom and can only be used once, you should practice using the condom on your own instead of using it for the first time right before sex. Though inserting the condom is easy once you get the hang of it, you should try it on your own at least once or twice to make sure that you can get it right when the time comes. Remove the condom from the package. Once you've determined that the condom is ready for use, just hear the arrow at the top of the package and remove the female condom. Put spermicide or lubricant on the outside of the closed end. Using spermicides along with the female condom can further reduce your risk of pregnancy. Though the female condom will already be lubricated, extra lubricant can make it easier to insert and use the condom. Find a comfortable position. To insert the female condom, you'll have to find a position that works for you. It's just like inserting a tampon. You have to get comfortable and have access to your vagina before you can insert the condom. You can try squatting on the ground, laying down, or placing one foot on top of a chair. Squeeze the sides of the inner ring together. Hold the sides together similarly to how you would hold a pencil. Though the condom will be a bit slippery because of the lubricant, make sure you have a reasonably firm grip before you insert it. Insert the inner ring and condom into your vagina. Insert it like a tampon. Push it up with your finger. Push the inner ring into the vagina, aiming towards the small of your back until it reaches the cervix. Once it reaches the cervix, it will naturally expand, and you won't be able to feel it anymore. Again, this is much like inserting a tampon. If you can still feel it inside you, then you didn't put it in correctly. Pull out your finger. Make sure that the outer ring is hanging at least an inch outside the vagina. If it's hanging much further out, you may need to check if the inner ring is really inserted correctly. Insert your partner's penis into the female condom. Once you've inserted the condom and are ready for sex, Have your partner guide his penis into the outer ring that is hanging outside of your vagina. You can help guide his penis into the condom correctly. Make sure that his penis is actually going into the condom instead of touching one wall of your vagina as well as the condom. Have sex. It's normal for the female condom to move from side to side once you're having sex. As long as the inner ring is still inserted and your man's penis is in the condom, you're good to go. If his penis has slipped out or the condom has come loose, you can comfortably reinsert it as long as the man hasn't ejaculated yet. Once the man ejaculates, you can remove and throw out the female condom. 5. If you hear a loud noise because of the condom during sex, you can apply more lubricant. Squeeze the sides of the inner ring together. Hold the sides together similarly to how you would hold a pencil. Though the condom will be a bit slippery because of the lubricant, make sure you have a reasonably firm grip before you insert it. Gently remove the condom from your vagina or anus. Do this slowly, while holding the twisted top of the condom together. Throw the condom away. Just like a male condom, the female condom cannot be reused. Just throw it in the garbage, do not flush it.